everyone, and good morning to those in Edmonton. Today we're here for a very special occasion.
Well, good morning, everybody. What a wonderful surprise. So my name is Sherri Di Lallo, and I'm the team lead manager for the Stollery Awasisak Indigenous Health Department.
So when you come on a call like this, Sherri, you're going, why am I here? You're probably wondering that right now. Children's Miracle Network has instituted some new awards this year called the Hospital Children's Impact Awards. And they hold an annual event in this month called the Children's Hospitals Week. The Hospital Impact Award is to honor a doctor, nurse, or caregiver who has made a significant impact to the care provided to children in their hospital and in their communities. And nominations are made by the hospitals and their foundations, and CMN received over 30 nominations submitted by their hospital peers. And the selection committee looked through the various presentations of awards and selected you. And there are some really good reasons why. Okay, now I'm getting emotional because I see you're getting emotional. But it was specifically for the Awasisak Indigenous program team for the work that you have done.
This award is about how you inspire us every day, Sherri, to be better versions of ourselves, to learn about the 7 great teachings and about our history and the place that we call Canada all together, but to recognize that our First Nations, Métis, and Inuit peoples are extremely special. They have different needs, different services required, and we need to treat them with the respect that they deserve. And you do that. So thank you and congratulations.
The model that she's created is one that others would do well to pursue, because it really does give the voice of the Indigenous families, shares their truth, speaks their needs, and then we're able to respond to that with the generous opportunities from the foundation. So Sherri, congratulations. I can't say how proud you should be of yourself and of your team and of the work that you've done. It's good on you.
You basically started with a grain of sand, if I can figuratively paint it that way, and you've actually molded something that is eventually much bigger, where we've got billions of pieces of sand that's actually starting to form actually something that is recognizable, that is appreciated, and that now then I guess the nations appreciate it as a whole for all the work that you've done. And the reason why it's evolved that way is because your input has been passionate, but it's created some dynamic steps in the development to ensure that all our communities get the services that they need. And you know, it's never fast enough, but what I can say is I don't think it could be as fast as it could unless we had you. And then the other piece of that is sometimes we need to move at a pace where we make sure we're doing things right. And I think you're moving as fast as you can, making it right. So congrats on doing the right thing.
Sherri, would you like to say a few words?
Well, I'm very overwhelmed. Thank you guys so much. I work from my heart, and I work from, I just want to serve and do the best that I can to support our families, and to have this award. I'm speechless. I feel so grateful, and I feel honored to be a part of this process. And I'm so glad that I'm making a difference for these families that so deserve the best care. And I'm so grateful for Susan and Sean for supporting me through this whole process, because you're right, Mike, without the leadership supporting me, I wouldn't be able to get anywhere. And they've been so open and caring and supportive in me doing what I need to do, and allowing me to be flexible in getting the information that I need, so we can provide a service that's based on what the community, the families need, as opposed to what we think they need. And so because they have the Indigenous voice, providing Indigenous solutions, I really believe that's why our whole program has been successful. And then just being able to filter it through to leadership and having that leadership support is immensely important. And I'm so grateful. Thank you so much. I'm not used to this kind of stuff, so I'm just feel really blessed. Thank you, thank you, thank you.
Sherri Di Lallo from Buffalo Narrows, northern Saskatchewan, launched the Awasisak Indigenous program at Stollery Children's Hospital with an important value in mind: to facilitate accessible, culturally safe, and equitable health services for Indigenous patients and their families. Operating as the first of its kind in Canada, this revolutionary program has done significant work in Indigenous communities to build and foster relationships of trust, ensuring that kids and families get the help they need in a safe, familiar environment. Sherri and her team provide support in traditional languages, offering ceremonial drumming and smudging, as well as a sacred prayer room on site to support the physical and mental needs of the patients and their families. By putting patients first, the Awasisak Indigenous program has reduced perceived barriers, marginalization, and lack of information at the acute care level, which has improved access to pediatric services. Thank you, Sherri, and the entire Awasisak Indigenous Health Program team for providing a culturally safe space for Indigenous children and families in the Stollery's backyard. And congratulations on receiving this year's CMN Hospital's Impact Award.